there.
Hi, my name's Karen. I was asked to follow you around today. I'm a student. Can you give me SBAR, please?
Yeah, certainly. The patient's name is Shanana O'Connor. Today she's 34, and she was diagnosed with fever and end-stage renal failure. They think that she has a urinary tract infection. She's a full cone, type 1 diabetes. She does have allergies to sulfa drugs. She currently has a temperature of 101.1, so we're going to be giving antibiotics today. Also, her white blood cell count's pretty high, which indicates infection. And she's alert and oriented ×3. She's ambulatory. She goes to dialysis 3 times a week. Starting the past year, she wears glasses. Past smoker for 2 years. Developed diabetic neuropathy and hypertensive nephrosclerosis. Like I said, today we're going to be giving, it's called Promexin.
Okay, and why specifically are you giving the client this medication?
Well, she had a fever of 101.1 and her white blood cell count was elevated.
What action does the medication have on your body?
The medication will bind to the cell wall, resulting in the death and elimination of the infection. Because it is a broad-spectrum antibiotic, active against most gram-positive infections.
When should you question administering this medication?
Well, we're going to make sure the patient's allergy history is that she's not allergic to this drug. Sensitivity occurs with those who are allergic to penicillin. Use consciously. We're going to, with patients who have renal impairment, which is her, it does not have a, oh, go ahead.
And does it have a therapeutic serum level?
Does not have a therapeutic serum level.
Which vital signs must be monitored?
Really all vital signs, but especially the temperature.
Okay, and what physiological parameters should be monitored when the medication is administered?
Well, the temperature and the white blood count. So we want the white blood count in between 4.5 and 11.1.
Okay, what interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
Okay. When taking antibiotics, it's important to continue to take all medications that was prescribed. Even if symptoms improve, we'll want to take the full prescription as to completely eliminate the infection.
Is there anything different that she would do at home if she was on this medication?
Well, she's probably not going to be on this medication, but if she was, then nothing different. We'll just check for temperature and just continue to take the full amount and drink a lot of water.
Was there any side effects and potential adverse reactions?
Yeah, diarrhea, nausea, vomiting, and then a rash like at the injection site. And then we also want to look for signs and symptoms of anaphylaxis.
And how would you know the medication is effective?
We'll make sure her temperature goes down and then also the white blood cell count.
Okay, thank you for answering my questions.
We'll go and see her. Hello.
Hi.
Can I get your name and date of birth?
Shanana O'Connor, 34.
Okay. Sounds good. We're going to give you an antibiotic today. First I'm going to hang some normal fluids for you, and then we're going to hang the antibiotic. You do have a right to refuse. Did you want to?
No.
Okay. Do you have any allergies?
Yeah, I'm allergic to sulfa drugs.
Okay. That's what it says in here too. Okay. So I'm going to first hook you up to the saline, which is the normal. Not the saline. First I'm going to flush it, but I'm going to hook you up to the normal fluid. Okay, so front. Do that, and then I'm going to flush it. Okay, name and date of birth again.
Shanana O'Connor.
Okay.
34.
34. sterile. Sorry if I'm getting all wet.
I need your bath in there.
Man, your tech didn't give you a bath yet?
No, she hasn't been in yet.
Oh, okay. I'll go get her after. We're done taking this. Okay. Okay. And then when we hang in the medication and start urine, do you know the side effects of the medication?
No.
Okay. What was we want to look for, or just let us know if you're having any feeling nauseous, or if you start to vomit, and then diarrhea, and then also if you start feeling like a rash or like a burning sensation, then let us know too. Also with this, and just make sure that expiration date and everything is in the order. And then for the medication, I'm going to check for clarity, expiration date, dosage, order, doctor, all that stuff. Okay, name and date of birth again?
Shanana O'Connor, 34.
Okay. Okay. And this is sterile. Oop. Okay. Just scrub the head. We're gonna backfill this. Take down your little sloppy thing. Okay. That's good. Okay. What? Secondly. Duration 1 hour, so you're gonna get the 500 milligrams over 1 hour. Okay. And do you have any questions for me at this time?
Nope.
Okay. And then so just make sure you just let us know if you have any nausea, vomiting, or diarrhea. That way we can get it addressed and make sure, and also like any burning sensation. Okay. Okay. And your breakfast should be here soon.
Okay.
And let us know, and you have your call light and
Yep.
everything? Okay. And then, I'm just gonna wait, before I leave, just gonna wait to see if it drops, 5 drops.
You guys, when you use these to plug, so like this is your blue top. So if you connect like that, then you can just do this like with your blue top. So you can just refill Okay, yeah, cause
Okay.
it's furnished.
Alright, there's the 5 drops, and then, so I documented that, and then just, hit the call button if you need anything, okay?
Okay, thank you.
Okay.
Okay, were there any pieces of information that you reviewed before administering the client the medication?
Where I've reviewed her temperature and the white blood cell count, and I also just looked to make sure that there was an order for that and
Okay.
correct time and everything.
Did this information affect your decision to administer the medication?
Yes, because if she didn't have a temperature, if her white blood count was normal, then we probably wouldn't.
Did it affect how you administered it?
No, because since she's in the hospital, it was just best if we give it to her through the IV to get the most effect out of it.
Okay, thanks Jessica for
You're
letting me
welcome.
follow you around
You're
today.
welcome. I'm just going to document the patient teaching.
Okay.
Okay, thanks.